now. Hello everyone, and welcome to the latest of our Understanding Health Talks from University Hospitals Dorset. And today's talk is based around fibromyalgia. My name's James Donald and I'm the Communications Lead for the University Hospitals Trust. And I'm very pleased to be presenting the talk today. But before we get on to the main speakers, Darren and Caroline, we've got a short presentation from one of our staff governors, Mary. So without further ado, over to Mary to tell us all about becoming a governor and also about becoming a member.
Thank you. Hello, my name is Mary Cleary. I am an organisational development practitioner in UHD with a focus on the health and wellbeing of our staff. And in my 32nd year here, I am privileged to be one of our team of 4 UHD staff governors, elected by and representing staff. In this role, I represent our non-clinical members of staff, sitting on committees and contributing the staff voice and experience to the work of our Council of Governors. There is a lot of exciting change and development in UHD, and we are really keen to engage with people in our communities and share what's going on in your hospitals. Trust membership is a really good way of helping us to keep in touch with you. Some of you may already be members of UHD, and if you're not, you may be wondering what this means. Well, there are 3 options to choose from, which indicate the level of involvement you would wish as a UHD member, and you will hear regularly about what's happening across the Trust. Our last few years have been extraordinary as UHD has responded to the COVID pandemic, and there is much to share now on how we are continuing to provide high quality care, working hard to reduce our waiting time for patient care, and taking part in the many changes across UHD, and looking forward to our future as our major builds take place on all 3 sites, which we will know deliver much improved facilities for the area when they are complete. In UHD, we love to listen to our patients, carers and families, and are keen to listen to the voice of our community, as this really helps us to inform our services and decision making. We also value the views of our UHD members, and so why not click on the link to the Trust member page on our website, which is on the chat bar, to find out more and take part in your local NHS hospitals. Thank you.
And thank you very much for that, very much appreciated. And once you're on our website, please also check out the pages on the future of our hospitals that will give you more details about the planned changes between Poole, Christchurch and Bournemouth. And now, without further ado, and they're going to introduce themselves, I'm going to hand you over to Darren and Caroline. Thank you very much.
Thank you, Jamie, and thank you for inviting us to these Understanding Health Talks. And our subject area today is understanding fibromyalgia. Just a little bit of background information. I'm one of the senior physiotherapists, outpatient therapists at Christchurch Hospital, but I also work in rheumatology. Rheumatology is often an area where the diagnosis is first made. Caroline, my colleague.
And I'm a senior occupational therapist, and I work in the area at Christchurch Hospital about outpatients, mainly in hand therapy, and we cover a lot of rheumatology is where my interest lies as well.
Yes, so we often are given the opportunity to help those patients that are newly diagnosed with fibromyalgia in terms of education sessions and offering some kind of onward support. And this is where our background lies. So if you're just here listening as a point of interest, or you know someone that suffers from fibromyalgia, or you may be a sufferer yourself, we hope that today's lecture will offer up something useful for you to take home with you today. And so without further ado, we'll get on with the slides. Caroline.
Just as a start, this is a diagnosis, the definition for the diagnosis that is often followed. It's was originally written in from the American College of Rheumatology in 1990. It has been reviewed since, but this is one that they still follow. It says it's a chronic, widespread musculoskeletal pain for longer than 3 months and in all 4 quadrants of the body. The chronic itself is not the chronicity and how much pain you're in, but the length of time you've had the pain of approximately 3 months. The widespread pain it talks about, it can start as a nucleus, as a small area of pain, but then you'll find it will become widespread, and it can be anywhere in the musculoskeletal system, whether it's in the skeletal system or in the soft tissue areas. There can be other diseases which run alongside it, and it can run on its own. There is a primary and a secondary fibromyalgia, and they will discount the other diagnoses to make the diagnosis of fibromyalgia, which we'll talk about in a moment.
Your rheumatologist will often, as part of his assessment, press these areas. So that the little slide there shows a graphic of the front and back of the person. The most notable point to take up on there really is that there's a sense of symmetry around these tender points. So most fibromyalgia sufferers will talk about aches, pains in all 4 quadrants of the body, and there's a sense of symmetry there. Move on to the next slide. So when we look at the prevalence of fibromyalgia, the literature suggests that it can be present in around 2% of the general population. The key feature is this chronic, widespread pain, although there are other features which we'll go on to in the next following slides. Caroline.
There are often investigations that are completed so that they can actually diagnose us fibromyalgia. There are no specific blood tests or x-rays or tests themselves that can confirm the diagnosis. It's more a diagnosis of exclusion. So they tend to come up with a diagnosis by excluding other diagnoses.
Yeah, so this is often why, for example, you can imagine that someone has had chronic widespread pain. They're unsure as to those reasons why they're getting it. They may present to a GP. The GP could make a diagnosis, but to be absolute, they may have a number of tests that they would do. They may end up referring to rheumatology, where there will be a whole series of screening tests to exclude other possible diagnoses. If those tests are all negative, in a sense, and with the clinical experience of that particular clinician, they will often come up with this diagnosis of fibromyalgia. So it's a deductive process. Next slide.
Ooh. With diagnostic journey of fibromyalgia, you will often be asked whether you had a trigger point or a cause of it. Fibromyalgia is often triggered by a stressful situation. It can be physical or stress, emotional, and it can be anything from an injury, a physical injury, through to an infection.
Yeah, those bullet points there, if you cast your eye down there, some of those are physical, some of those are emotional. I would argue that if you've had an injury, for example, you know, there's going to be an emotional element to that as well. And so we can't really sort of set them out separately. You know, often some of these are combination things. As I say, often it's really useful to kind of cast your mind back to a time before you have had fibromyalgia, because that may offer up some clues as to what the origins, the trigger point of pain is, and that may, in some instances, offer up some ideas as to where one might start in terms of a self-management treatment approach. Next slide. So here we're just bulleting a whole series of clinical symptoms. If
you have a look down the list, you'll find that it will start with the painful side of it, and because you get pain, you often find that you have a disturbed sleep pattern, and so from sleep and you get an unrefreshed sleep, which will cause in itself your daytime fatigue and tiredness, and from that again you get forgetfulness and fatigue, poor concentration, sometimes stiffness. It can lead into headaches and irritability and low mood.
People will often talk about a fibro fog, won't they? Where they feel that their brain, their thought processes are a bit foggy. And
you'll often find those people themselves have a poor sleep pattern as well. One thing just to look at the bottom, it's you'll see that there's an increased sensitivity to cold, knocks, bumps, sounds, touches, and these can be very painful as well. And this is a symptom that people will often find and not always understand why it's happening.
This is a really important point to focus on. Some of those other ones may be very individual, but for most fibromyalgia sufferers, pain, sensitivity is a very common set of symptoms, and it does elude and throw some light on the possible origins of why these hypersensitivities are emerging. And as we know that, our nervous system conveys an awful lot of information to us. It tells us when we have been pressurizing tissues and we can withdraw from movements, for example. It can tell us whether there's too much noise in the room, for example, or perhaps there's too much light for our eyes. And when these systems are working well, we use them very well and efficiently. And what we're starting to understand with this hypersensitivity, if you like, is that those thresholds at which these systems are firing start to change. And so therefore, fibromyalgia sufferers will start to feel pain, for example, with physical stresses or things that would otherwise not be painful. So, for example, the hug of a loved one would be painful. Someone might be watching television with their family, and for them, the sound is up incredibly loud, but for others in the room, it's actually quite a nice, pleasant volume level. And the same goes for light and those kind of things. We're going to go on into that in a little bit more detail, but that's something that's really important to hold on to there.
Something that we mentioned just now is regarding sleep, and just to give you an idea of the cycle of sleep pattern, there are 5 stages of sleep. The first one is quite a light sleep, where it's just when you're starting to relax and start to go to sleep, and into the second stage is where you'll have rapid eye movement. This is the part where you're dreaming, and you're starting to sort of file away the things from the daytime. You're starting to relax, and you can start to go down into a good deep sleep. And this is where you can go down in the 3rd and 4th stages, where you go into the delta stage, which is the restorative sleep. This is where you forget your dreams. You'll find that you relax completely and you get yourself ready for the next day.
Yeah. And this is another key interesting point here, that more often than not, most of our newly diagnosed audiences will say, yes, my sleep is not good. And there's the simple premise here is that if you're not getting into that deep phase 3-4 sleep where there is a restorative, rejuvenative element to your body's workings, you then wake up feeling unrefreshed. The second part of this slide, the cycle of pain and sleep disturbance, you'll see on the left there are three boxes: localized muscular joint pain, disease, illness, and anxiety, life crisis. So what we should recognise is that there are awfully different reasons for why people may start to get poor sleep. So it may be that actually they are in pain, and with the pain it's difficult to get off into sleep. It may be actually that they have a primary condition, the secondary fibromyalgia is emerging, the primary condition is in flare, it's making them difficult to sleep. and so therefore that's the reason for their poor sleep. And that third box, anxiety, life crisis, if someone has had a stressful, emotional, turbulent time, and those thoughts surrounding that narrative around that stressful time of their life, as Caroline said in the previous slide, maybe, you know, for example, the loss of a loved one, financial stresses, physical stresses with injury and so on. Those could be mulling around in your brain, and that means that it's very difficult to relax and settle into a deep sleep.
And when you can't sleep deeply, you'll find that it will also affect your daily life. And as it says in the other two boxes on the right-hand side there, it gives you difficulties with daily activities, fatigue, as we mentioned previously, pain and tiredness, and all of this builds up into poor sleep disturbance, and also difficulty with daily life.
Yeah, and unfortunately, these are positive feedback cycles. So as that feedback loop suggests on that side, that you then find it difficult to sleep, you don't get the rejuvenative processes because you wake up with a fog, you're irritable, you're tired, you're low in mood, and the whole process winds itself down into this ever decreasing cycle. And this is what we often find with patients with fibromyalgia. They really do find it a struggle, because part of the process of this problem is the poor sleep quality they have.
Something that often needs to be highlighted with those people in pain, especially with a chronic pain disorder, is have a look at what they call sleep hygiene, and how you can get yourself off to sleep and get a pre-bed routine to install good habits. Just out of when we all have children, or animals, we get them into a good routine before they go to bed, so that they know that it's bedtime, ready to go to sleep. So we suggest that anybody who's in pain and has difficulty does a similar sort of thing. So you look at your sleep routine, try and get yourself relaxed before you try and go to sleep. Try and avoid too many daytime naps, because that can take away your tiredness when you're trying to get off to sleep. And they do suggest not to lay in bed awake for a long time. If that happens, sort of get up and do something and then come back. The TV and the computer, they do suggest that the light that they emit, the white light, will actually wake you more, so that it's like, they liken it to a double espresso. If you pick your phone up and have a look at that, if someone sends you a text just as you're going off to sleep. So that suggested that you leave all of that out of the room. But there's also quite a lot of research that's suggested that the smartphones, laptops can also help you to get off to sleep using their programs and their apps, and the sleep apps, the white noise, sometimes a nice relaxation tape that will help you might help you get off to sleep.
Yeah, modern smartphones, they can offer up those apps, as Caroline said, and they're often designed with that in mind, that they want to reduce stimulus, so they will change their screens down to a more blue light or a lower light. They will stop the notifications pinging beyond a certain time, and those are sort of things. So the technology companies realise the importance of sleep for everyone, and that's why they're building them into their phones. Say, what we think about this sleep hygiene is really getting back to those simple basics, get into those good routines, and make the bedroom a place of sanctuary and rest. Sometimes these things that creep in, like TVs and laptops and tablets, and they can be quite disturbing. And the whole point of really trying to get good sleep is to get yourself into a restful position, and that can be really good for somebody that's suffering from fibromyalgia, which is why we've just mentioned the importance of sleep. Okay, so we're going to pause here for a moment and run a video. Hopefully it should run quite smoothly. It's a small 5-minute video which we will just run from our Australian counterparts, and we will then discuss what the sentient points are there. Okay, can we run that video? Is that possible?
Just coming, just coming.
Okay.
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed, as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed, many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up pain, It comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So get a helping hand if you need it, set a goal and begin.
Okay, so we will return to our slides. So we find that a really useful summary of the complexity of pain, and as I said in previously, pain is a very dominating feature of fibromyalgia. What we like about that video is that it sort of, you could see that the speaker summarised it into sort of the sum of more than one part, if you like. So often in the patient narrative, they're searching for something that will alleviate the pain. There will be a singular thing that they often think, well, look, if the diagnosis is made, you know, the doctors will be able to treat me, and they'll be able to offer me a treatment and I'll be cured. And actually with pain, it's more complicated than that, as the speaker said, and it's often multinodal. So she talked about those 5 elements of our lives, actually. So we might think that a medical approach can be useful, and it can, but it won't necessarily be the singular answer to alleviate the symptoms. Actually, that sort of emotion and well-being part of our lives, our lifestyles, the personal stories surrounding the onset of this particular condition, and the importance of physical exercise. As human beings, we are mechanical and we need to move for all sorts of reasons, and we need to think about that even more so when we have a chronic condition like fibromyalgia. So we'll move on to the next slide. So we're going to go through, that slide looks a little busy, but actually the top heading there, medical approaches. So certainly medical approaches definitely have a part to play in fibromyalgia. It's probably more useful and productive for the person who's suffering to think about, well, okay, I might consider medication. It's better to target a certain area. So, for example, if there is poor sleep in this patient narrative, then actually sleep might be an area where a pharmaceutical approach might be helpful. So a GP, for example, might offer up a medication called amitriptyline. It's a tricyclic analgesic, and it's purely designed to enable that person to get a full deep sleep. And remember, the previous slide just touched on a bit of detail about how important that deep phase 3-4 sleep is for the restorative and rejuvenative processes that our bodies need to do to get us ready for the next day. It might be, as that slide suggested, that pain is the dominant feature that stops the person getting good sleep. So actually some analgesia might be helpful. So it might be over-the-counter paracetamol, it might be over-the-counter ibuprofen, possibly, although I would always suggest, I should make that very clear now actually, that all of these ideas would be in partnership and in conversation, if not with a rheumatologist, certainly with your GP. So you can have a talk to the GP about those analgesics to help ease pain in order for someone to get good sleep. If there's been an element of nerve pain established alongside the condition, and I should stress that's not always the case. Some other medications, for example, gabapentin, pregabalin, might be considered, but again, that will be certainly with your GP, if not with a consultant rheumatoologist, and you know, that's the sort of conversation that you would be thinking of having with those skilled practitioners there. That second bullet, it talks about complementary medicine.
The complementary medicine, as Darren was saying, it's something that a lot of people are looking at the moment. It's something that people find that they feel more comfortable with than some of the pharmaceutical pharmacological medications. However, if you are going to take some herbal medicines or anything, some of them can react with other medications that you could be taking. So it's really important that you discuss this with your GP or your prescriber already.
Absolutely. So, you know, the word herbal conjures up sort of natural. Actually, some of these natural remedies can be quite potent and actually have, you know, not great interactions with something you're already being prescribed for. So it's so important to have a discussion with the clinician, and the first port of call would be your GP. We've put herbal, and there's a whole range of things, and we're really not qualified to comment on those. But one that seems to be very prevalent in the press and you know, out there in the literature at the moment is something called CBD oil, which is cannabidiol. Again, we're not proposing that that's in any way, we're not supporting that, we're proposing that it would be useful, but we're just having that grown up conversation along the lines of, we know it's out there, we know people are making claims about it. Again, I would speak to your GP about it, or certainly encourage whoever is suffering to have a skilled conversation with a prescriber. Cannabidiol is the non-psychoactive part of cannabis. THC is the psychoactive bit. That bit is illegal. However, there are producers out there that produce CBD, and you will find it in places like Holland and Barrett. You will find it in places like Boots, and you will find it in places online. So providing they can establish that the psychoactive piece, THC, is removed, people are selling these things, and the claims are along the lines of, yes, it can make you relax, yes, it can ease pain. We hear about this from sufferers. Some people say it's useful, some people say it's not. So we'll probably leave it there, but we felt that it was important to at least mention it, because we know it's talked about an awful lot. The final bullet there, surgery. This is an interesting point. If you have a very focal area of pain, like Caroline said, it may start there, but it may not finish there. People that think surgery might be the answer, again, the video said think again, because it's not so much that there's any kind of target for the surgeon to work on, because as I alluded to in the previous slide, it's more to do with the nervous system, which might be more central actually, and not actually where you are feeling the pain. So it's always important to get a second opinion. Having said that, just because you have fibromyalgia doesn't mean to say that as we get older that you don't pick up quite an osteoarthritic joint, and so some surgical procedures might be appropriate, but it's not treating fibromyalgia, it's treating the osteoarthritis, if that makes sense.
There also is a non-pharmaceutical management area. So EULAR guidelines, they recommend using a mix of approaches to manage fibromyalgia, and they always depend on each individual, and you're likely to be asked if you can remember a time before you were diagnosed and how your journey has gone since, and by starting from how you felt before you had your fibromyalgia, the non-pharmaceutical management can often work through that, whether it's through a talking therapy or a physical therapy.
Yeah, we definitely know the people with the most successful outcomes are people that have taken ownership and have self-managed with a mixture of a multinodal mixture of focus. So, for example, thinking about their sleep, thinking how they can become less stressed, less relaxed, and thinking about their physical health in terms of exercise, activity.
I mean, there's some self-management ideas stated here about pacing. It's not just pacing yourself, but looking at the activities you're doing, and to try and do a heavy activity against a light one, and not try and do too much during the day. just grade your activities so that you're not overdoing it and not bringing on that fatigue and the fibro fog that we mentioned earlier. Exercise is always really positive. You'll find that that will actually help with both your strength and helping to reduce your pain levels with a natural pain reducer. And sleep we've mentioned already, and relaxation. And at the bottom we've just put something called the persistent pain toolkit. This is a gentleman who's had a lot of pain himself, and he has put together a toolkit which gives you some very good ideas about what can be used to help it.
Yeah, his name's Peter Moore. As I say, he struggled with pain. He's not a clinician, but he started to piece this together and was listening to the advice and making himself educated about the area. It's not a site specifically for fibromyalgia. It's a site for people that suffer with a chronic pain syndrome of chronic pain. So that can be a useful resource point to dip into. We'll go to the next slide, Caroline. So if we're thinking about the hand again, we're looking at our emotions and well-being. And the first point there is really, and you know, this sounds a little bit sort of, for some people, they say, well, this sounds a bit selfish. No, it's not selfish. Be kind to yourself. And what we recognise is that often with people that suffer from fibromyalgia, the good things in their life, they've kind of prioritised down the list, or that it's been squeezed out, whether it's because they are desperately trying to manage the demands of a family or work, or they have someone that's relying on them as an emotional support. And slowly the drip effect is that they start to squeeze out the things that they enjoy. And actually what we do know about pain is that when someone is enjoying themselves, they are lifted in mood. When we are in a better mood, an elevated sense of well-being, the point at which we discern something being painful rises, so we can do more before the onset of pain. And what we also know is that those people that are in low mood, that feel helpless, depressed, those thresholds at which pain is discerned lowers, so we can do less before we start to get a painful output. So being kind to yourself, Caroline, the kind of things would be...
It can be really helpful to give yourself some time for yourself every day. Relaxation strategies are often a very good idea, so that you can give yourself 15 minutes, half an hour to try some relaxation. There are many different kinds out there. You can find them on the smartphones. There are many apps. There's some that will call visualization techniques, where someone will talk you through an imaginary, rather pleasant experience, whether it's walking along the beach, swimming in the sea, whether it's walking through a forest, collecting flowers, anything like that. That can actually, because it will put you in a good place, it will help you feel happier, and therefore help to reduce your pain and ensure you relax a little bit more. There's also the musculoskeletal kind of relaxation, where you're tensing and relaxing. Some people find that really helpful, because they can actually see themselves doing things, and you can relax in between that, especially if you learn to breathe at the same time.
Okay.
And we've already mentioned the sleep hygiene plan.
Talking therapies, that's a broad range of options actually. So seeking support, if you like, from a loved one, a trusted person, you're confident, that would actually be talking therapy. But for some people, if there was a huge emotional trigger, which is a very impactful area of life. So, for example, an abusive relationship or something like that. You know, I'm just picking something out of the sky there. Some of these things are altogether need to be dealt with a more professional approach. So, a clinical psychologist, for example, and this comes back to that personal plan a little bit. So, trying to get a feel for like what was the trigger. If there was a huge emotional trigger, the problem has been unresolved, talking therapies is often a really good thing to do for something that would be that severe, but actually just sharing with somebody who is a friend, a confidant, a loved one, someone that you can trust, that would also be a form of talking therapy. We'll move on to the next slide. So, yeah.
So the next slide is about lifestyle and about work-life balance. And if you can do some work and also enjoy yourself with your life as well, that's important. Going to the 4 Ps, it's just something that's talked about, sort of planning, prioritising, positioning and pacing. At the same time, you're problem solving what you need to do during the day. You need to look at the things that you really need to do. And one of those things is have me time, which is the time we were talking about just now, how important it is to have some time for yourself so that you can help to relax and manage your own life and condition, which will help you through. And if you can prioritise your day so that you look at the important things, also do tasks some which are heavy, some which are light, and look at how you're feeling when you wake up in the morning to see which ones you'll be able to manage and see if you can put some off or ask other people to do them for you. Positioning is something that a lot of us don't think about. Whether you can do the activity sitting down, whether it's worth using a gadget to help you so that you're not stretching so much or lifting so much. Positioning will just give you just a little bit more availability to function better. Looking at pacing, we're just breaking up the tasks. Sometimes you have to analyse your activity and actually change it so that you can facilitate using different gadget or a different technique so that you can achieve it.
Looking at your physical health as a physiotherapist, obviously that's a point of interest, well, not just as a physio, but as an occupational therapist. We know the #1 treatment for fatigue is actually increasing activity levels, but really having a look at that, often people say, well, how on earth can I, how can I become more active? I can barely exist at the levels that I'm at. But what we know, if it's done carefully in a graded and paced manner, actually the effects are that those people are usually about 6 to 8 to 10 to 12 weeks later are saying, look, I'm feeling more energized, actually I'm feeling potentially less, I feel less pain, or I feel in control, I'm feeling I'm able to do more. So these are really important things to consider, and that we bring that under the lifestyle heading. I think when we first meet these newly diagnosed patients with fibromyalgia, I think they all agree that fibromyalgia has driven them down into an area where they are less able to do the things that they used to do or they like to do. And arguably they are more sedentary, they are less active. And what we know is that, not moving in the way you would, we know that these muscles decondition and become weaker. We know ligaments that support your joints can become stiffer. We know the nervous system, as we talked about earlier, can become more sensitive. So all of these things can start to give you stiffness and secondary features. So your joints become stiffer, your bodies become weaker, and these then start to get the person into a downward spiral. And really what we're alluding to here is we need to chop into that downward spiral somehow and actually sustain a level of activity that we can cope with. Once you've established that, once they've established a baseline, then they can progress from that. And that's where, support, local support, that might be from local services, either in-house in the hospital or outside. So, for example, there is a local fibromyalgia support group. These are where those people can support you through those progressions. We get diet, don't we?
Yes, we've often asked about diet and nutrition, but not being dietitians ourselves, we do direct people through to the fibromyalgia booklet, which is written by Versus Arthritis, and that gives you some ideas. And really, it's whatever suits the individual. The number of people we've spoken to, we often find that people say, well, this diet's great for me, but other people will say that one's better for me. So it's really whatever suits you.
Yeah.
And the last picture you've noticed on this slide was the gentleman at the top slouching in his chair. If you recall, on one of our very first slides, you had the picture where they were diagnosing
Points of tenderness.
The point of tenderness
across the shoulders.
And you find that this can actually be aggravated by this positioning.
Yeah. So you can see the guy on one side with the term correct sitting. We would describe that as a neutral sitting point. When we're slumping is not a problem. It's not a bad thing to do. We all slump, but actually if we sustain that position, it can put a stress on the nervous system. And if you've already got a nervous system that's hypersensitive, it's probably good to adjust the position. So actually, this is why we feel getting less sedentary can be really useful. And if you are sitting, optimize your position so you're not stressing the nervous system. As physiotherapists, when we're testing the nervous system to see if it's relevant to the person's pain, we will often put them into a slump position to see if that brings on some of their pain. And so you can see that this big C-shaped curve that we put ourselves winds up the nervous system. So we feel that it's really not useful if you've got fibromyalgia to further sensitize the system. So a simple thing like good posture is a really good place to start. Okay, so we're gonna just hopefully tap into another video that lasts for about 5 minutes. It's called 23.5 hours. It's been put together by a guy called Dr. Mike Evans. He is a professor of public health in Canada, and he works as a GP and studies at the lectures at the University of Toronto. He has a whole load of health lectures, but we're just running this one for you.
Hi, I'm Dr. Mike. I'm presenting this visual lecture called 23.5 hours in partnership with 24-Hour Fitness. It's great to be working with people who have a passion for helping others achieve their individual fitness goals and promoting positive change in their lives. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research. And I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described in the previous slides. So if exercise is a medicine, what's the dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. but I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week or more, if you're a kid, an hour a day, if you're a kid, my flag goes up in the clinic. So my personal take on this is that, the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that, the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. If you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities, but my question to you is, can you limit your sitting and sleeping to just 23.5 hours a day? So whether it's hitting the gym and attaining fitness goals or walking a dog or taking the stairs, get out there and be active. Thanks again to 24 Hour Fitness for bringing you this message.
Okay, so we'll move back to our slides. I should stress that wasn't specifically and exclusively directed to patients with fibromyalgia. However, we are all human, as are people that are suffering from fibromyalgia, and we all need to think about maintaining exercise activity levels. And I would say that even more so if there has been a diagnosis of fibromyalgia. So important. We cannot underestimate how important that is. So if someone is in chronic pain with fibromyalgia, movements, as I say, the instinct may be not to exercise, but we know that route leads us to be less active with all those things I've described earlier in terms of muscle weakness and stiffness and hypersensitivity. We know, therefore, that when you do embark on increasing your activity levels, that the movement should be gentle, progressive, not over ambitious. Expect some discomfort initially, actually, and that's quite a normal feature when we start on something new in terms of activity. But we know, generally speaking, it is sort of usually between weeks 8 to 10 to 12. The person who's embarked on a careful graded exercise activity program will start to describe features like, I'm feeling less pain, I can do more before the onset of pain, I'm feeling less stiff, I'm feeling a little more stronger, a little bit more able. Actually, I'm feeling a little bit more energized. I assumed that doing more would mean that I would even have less energy, and actually the reverse is happening. And I'm starting to sleep better. I'm starting to feel that I'm looking forward to my sleep. And as I say, one of the biggest things that people describe to us when we see them actually with some of the options that we offer in terms of exercise is that they actually feel really good about it. They actually feel they're doing something they're in control of, they're seeing good effects, their mood is lifted, and that downward spiral starts to stabilize and they start to lift themselves out, and that spiral starts to rise up. where they're doing more, they're feeling less pain, they're feeling more energized, they're feeling lifted and moved, and the whole process is winding itself out of this chronic pain condition. So next slide, yeah, Caroline.
Okay, and one of our last slides is just a reminder how important the personal story is, and just thinking about anyone with fibromyalgia. When did the symptoms start? Can they remember a time previously? And if that can be remembered, then often the trigger can be remembered as well, and it can be treated with talking therapies, or it might even need other intervention. And it's all down to sort of self-management, so that you can actually improve and move yourself forward. And each time you think about a trigger or reason why it started, you can look at it like a jigsaw puzzle, and each little piece will fit together. And as it does that, it means that you can slowly improve and get your life back.
Yeah, I think that's a really nice analogy, a nice way to think about this, that on their own, you may find that improving your sleep, focusing in on something, focusing in on sleep, because I've got poor sleep, you might find that, it gives you a 10% improvement, 15%. You may find that, you might think, well, I'll take it or leave it. But actually, when you start to add it to the fact that you've got an activity program, maybe you've started to put some nicer things into your life, each of those incrementally might give you 10, 12, 15%. And suddenly you're looking at something like a 40 to 50% improvement. And I think, when we asked people that are newly diagnosed and said, look, if we had a treatment option for you that made you feel 50% better, they would jump at it. So it's not, the message here is that unfortunately there isn't a singular thing. Actually, perhaps really, because we are human, it's much more complex than that. And actually it's a combination of things that accrue to give us a more sustained long-term beneficial output.
And all of the self-management techniques and the therapies that can put you in the right direction to help yourself to improve your symptoms.
I think we've got one more slide.
If it will let me do it.
So this again, looking at analogies, metaphors, imagery, if you like, we've got a bouquet here, and really the bouquet is just to illustrate the point that we're all different, and so your treatment plan is going to be different. If you were to put 10 people in a flower shop and say, pick your nicest bouquet, some of those flowers would be very common in those bouquets, some of those flowers would be individual to the person who's picked them. And I think that's the main message here, is that your treatment plan has been designed by yourself, because it's personal to you. And as different as we are, our treatment plan may have quite differences, but some commonality as well. It doesn't have to be entirely on your own, so you can get a helping hand. So local services can assist with improving exercise activities. Local services can help dealing with difficult issues that are unresolved. And so, these are things that as an individual you might have to consider. And with the support of your GP, for example, you can start putting this plan in place and start to get some really great gains. So anything there, Caroline? Anything else to add?
I think we've covered everything there.
So,
and thank you very much for listening.
We're happy to take some questions, and I think that there have been some questions that have come in to the communications office with regard this area of fibromyalgia. I don't know, Jamie, whether you put the questions to us, or do we read through them, or?
Do you want to read through them?
Okay, right.
Is that okay?
Okay, yeah, I can see them. Yeah, so is fibromyalgia hereditary? Well, I think the answer there is no. However, we must understand that there is a nature part to how we develop. So we may be in an environment where maybe that might be similar in terms of what our parents may have been brought up in, and that could have some bearing on why they have chronic pain and I might have chronic pain. So that's where I think the confusion can be for some, but I don't think that there is actually a hereditary thing in terms of a gene that we are aware of. I think we need to look at it more holistically in terms of our environments and how we can change how we are living.
And can you recover completely from it? Well, you can self-manage it, which is hopefully something that we have highlighted in the presentation here, and given you some ideas that how important self-management is.
Yeah, and I think the thing about this is that it's a fluid thing. So, like all of us, actually, there will be times where we are feeling very energized, we're feeling that, we are elevated in our mood, and there'd be tough times for all of us. And I think when you have a diagnosis of fibromyalgia, that change will be reflected with fibromyalgia. So, there will be times where it might be more prevalent, more impactful on you, and there'll be times where actually you're really getting control of it, and actually you can bear, you barely notice it because you're in a really good stage. And I think, with a good life plan, a good plan, you can really keep it. You can start to control it rather than it control you, and that's a big, that's an important way to look at these things. Why are some parts of the body affected and others aren't? So, well, we talked about, we looked at that image of the person front and back. We know there's a certain symmetry, actually. We know if we look at the term itself, fibro and myo and algia. Fibro refers to connective tissue, so those soft tissues that we have. Myo relates to muscle, and algia just means pain. So we know that it seems to affect those connective tissues and muscular areas, and that may be because actually they are very intimately interwoven with our stretch receptors, our pain receptors that feed into the brain. So we probably will find that we will have more symptoms in those sort of areas. But remember, I did say that for some of us, as we get older, we may pick up a particular problem with a particular joint, and we may have an osteoarthritic hip, which we would the fibromyalgia make that 10 times worse for you as someone suffering from fibromyalgia, as opposed to someone with the equivalent osteoarthritic hip but doesn't have fibromyalgia.
Can some medications make symptoms worse? We went through some of the medication that could be prescribed for you, and you definitely need to talk to your prescriber, your GP or your consultant, if you were taking any medications, especially if you felt that these were making it worse. They would usually look at your symptoms and give you something which was relevant.
I think the important thing there is that you are the expert there. So if someone prescribes you something and actually you feel that it has made it worse, you let that prescriber know, because you're saying, because it's not helpful. One which can be helpful in the first instance that may end up not being helpful. For example, if you say to your clinician, look, I've got terrible sleep, and they prescribe amitriptyline, it's usually prescribed at a very small dose, 10 milligrams. And sometimes people get on a bit of an escalator there where they're saying, well, it's not really helping my sleep. And then they get prescribed 20 milligrams, 30 milligrams. I've heard people going up as high as 75, 90 milligrams. And what we know is that it's a 12-hour medication, so that it can have a side effect of actually making you feel more fatigued and drowsy, going beyond the 12 hours that you wanted to feel energized. So, the bigger the dose, if someone's on an increasing dose of amitriptyline and they're still climbing that dose, I would question whether that's actually being helpful for you. can I be considered for disability benefits for my condition? It is a chronic condition. I have to say, we're in the game of enabling function, so we're not completely au fait with the ever-changing rules with regard benefits, but we do know that people do go for PIP, and some people are successful and some people are not successful. I guess that my answer to that is we think that some people do get support, benefit support, and some people don't. And I think, you know, there's a whole mechanism there to challenge these things. There are some people that might support you through that process. So, for example, a local fibromyalgia support group, there might be some information to help you there. But I have to say that Caroline and myself are not completely au fait with the ever-changing details of the benefit system.
And lastly, should I still take my medication even if I feel fine? Often it's depending on the medication they're giving you. For example, if it was the amitriptyline to help you sleep and it's improving your sleep pattern, it is worth continue taking it because it's helping you with that sleep pattern, which is giving you a benefit of your sleep, and therefore you're more restored and ready to meet the next day. If you feel that you no longer need to take it, you please talk to the prescriber first before giving it up, because sometimes because you're on the medication, it's what's keeping you well.
And I would just finally make a point on that issue is that don't forget, when we looked at that video with the 5 points, medical options was just point number 1 actually. So yeah, it might be helpful to continue it. You might be in a position where you've made significant gains that actually that becomes less of an important part of your personal story. So again, I suppose that does come back to the individual, and you being the expert, you're in the loop there, that you should make a judgment and then seek advice from your clinician in that regard.
Especially if you're managing more by yourself, with sort of the self-management techniques.
Yeah.
And if you're managing those and the relaxation, the managing everyday life, you might find they can meet in the middle.
Yeah, so I think that just wraps up all of the questions. So we just want to say once more, thank you for listening to us. Thank you, Jamie, for inviting us to this health talk. And we hope, as I say at the start, we hope that you might pick up some useful bits of information there, and whatever you hope to use it for, whether it's for yourself personally or to support a loved one, or just as a point of interest. You may be a member of staff in the trust and weren't quite sure exactly what fibromyalgia was. We hope you found something useful there. Okay.
Thank you.
Thank you.
And thank you both very much for that. It was a fantastic talk, really appreciated, and so much great information there, and how people can help manage the condition themselves, from sort of sitting properly, exercise, sleep, etc. So really good advice. Just also to say that there is a library of all our events on our website, so this will be on there as well with all the other talks. So please do use the resource and have a look through and see if there's anything else of interest. But really just a massive thank you to Darren and Caroline for this talk. A really good afternoon and really appreciated. And thank you all very much for joining us.
Pleasure. Thanks for inviting us.
Thank you.
Thank you.
Thank you.
Bye-bye.